And good afternoon. Good to hear that music on this Wednesday afternoon. Always kind of signifying that it's time for Helping Seniors of Brevard. Let's get things underway as I introduce Kerry Fink, the Executive Director of Helping Seniors of Brevard, and the host of the show, along with his special guest for today, Dr. Lee Sheldon. But Kerry, go ahead. It's all yours.
Well, thank you, John Harper. What a great time it is every Wednesday to gather around the radio at lunchtime and celebrate all the good things about helping seniors and getting some good information that will help you. You know, here we are. We're right in the thick of the holiday season. First of all, I wanted to thank everybody who came out to the Helping Seniors holiday festivities. We do a monthly gathering there at Zon Beachside. We call it the Senior Resource Center Brevard Community Information Series. And normally we have a lecture that has something to do with our theme for the year, which is getting your ducks in a row and helping make your aging plan. But yesterday we decided to throw the script out the window and just have a holiday party. And Chef Jason at Zon Beachside, he put on the dog, which somebody said, I don't know that expression. I said, well, it's a Southern expression. It just means they pulled out all the stops and made it just an unbelievably fun time. And we also had Lori, I'd like to teach the world to sing Hafer, and her husband, Mike Hafer, were there and just brought some great holiday music, Christmas songs. It was just a fun time. And so I want to thank everybody who came out and made that a big success. And a couple other quick announcements. But by the way, hello, Dr. Lee Sheldon. How are you today?
Good, Kerry. And how are you today?
I'm excited. There's so many good things going on in the Helping Seniors world. I just literally on Tuesday was at a luncheon for a group called the Space Coast Florida State Guardianship Association, and they take a vote every year and decide if they want to support a charity. Actually, they support several charities. Let me be a little bit more clear. They really do a lot of good service in our community. But we, as Helping Seniors of Brevard, once again this year, were selected to be one of the charities that was awarded a cash award that goes directly into the work of helping seniors. And so we really are thankful for that. And then actually on Thursday, a very important group that does a lot of work in our community, another nonprofit called BAWS, which stands for Brevard Area Human Services. It's a lot of people who do a lot of good for a lot of folks in the community, and especially seniors. And they do the same thing. They get together at the end of the year and they all vote and decide on a charity or a couple of charities that they want to get behind and support. And so again, in 2022, we're so honored that they've selected us to receive an award. And, you know, as a Florida nonprofit, Dr. Lee Sheldon, you've helped us along year after year. You have your own program in the dental practice, which I think you call it Solid Bite Gives Back. And that has really helped the work of helping seniors. But, you know, if people don't get behind our work, we can't do the work that we do every day in this community, Dr. Sheldon.
That's right. And this network has grown and grown and grown. I remember when we first started helping seniors and how small the network was. And John Harper was with us right from the very beginning.
You know it.
and getting things going. And so, but you're right. The more sponsorships we have, the more donations we have, the better the opportunity there is to serve more seniors.
Now,
you know, I've got a question for you, Kerry.
Sure.
I'm putting you on the spot because I didn't prepare you for this.
I'll do my best.
Okay. So here's the situation. We have a number of patients in our office who are elderly, and they have to make major decisions with regard to what's going on in their mouths. And they don't always understand what's going on, or they forget, and then they call back and they call back and they call back. And essentially, they're left to make decisions on their own that sometimes they're just not capable of making. Is there something or some resource within helping seniors or maybe outside which provides a patient advocate so that somebody can help that senior make a decision on what needs to be done and how it should be done?
Well, you've just opened up a real important part of the work that we do with helping seniors in that. So, this is going to be a roundabout way of answering your question, because the answer is really pretty complex. But to start with, we always tell people, give us a call on our senior information helpline. That's a free call. It's 321-473-7770. You're going to get a friendly voice who really does care, 33 years of registered nurse experience. Her heart is totally in this. She's been caregiver for a family member. She, like you, Dr. Sheldon, and like John Harper, were helping Joe even before Helping Seniors existed, going back to the days when Joe was trying to get those Joe's clubs built and everything.
That's right. So That's Nancy Deerdorf.
Nancy, we're talking about Nancy Deerdorf.
Yes.
And she takes those calls, and her role is to try to make sense of situations that really oftentimes don't make sense. And I got to tell you, Dr. Sheldon, I know you've been around this, so I'm almost preaching to the choir. A lot of times it's the senior themselves who calls in with a question. Many times it's a family member who calls in on behalf of mom, dad, aunt, or uncle, or some relative that this is going on, and they're trying to step in because they are concerned about just the kind of questions and things that you just pointed out. They can't remember things, they're not understanding what needs to happen here and all that. And then there's a third category that we get calls from quite frequently, and it's literally just a concerned neighbor. I live across the street from Mrs. So-and-so. Her husband died a couple of years ago, and she's on her own, and I don't know. The house looks bad, and is she okay? Is anybody checking on her? We get a lot of calls like that. The good thing is that Nancy, with her expertise, and certainly Joe, with his decades of experience in all this. I'm talking about Joe Steckler, our president and founder, the guy who got Helping Seniors going all those years ago. They both have so much knowledge and insight in where to go. Now, so it's always worth a call. That's the place to start. Last month, I was going to actually mention this anyway, Dr. Sheldon, is last month was a record month for Helping Seniors in a good way and a bad way. It meant we took 881 calls in October, which set a new world's record for us in terms of seniors and those concerned for seniors served. So that's a good thing in terms of hey, we're making headway. We're talking to a lot of people. The sad part of it means is there's that much need out there. Now, specifically to try to drill down a little bit on the question. We have some great elder law attorneys who have been associated with the radio network for years, including Bill Johnson, who's every first Wednesday of the month, he's our regular scheduled guest, and he always brings such good information. And this is one of those challenges that they face every day of their life. Somebody comes in and says, listen, we're trying to determine if this person is on the beginning stages of dementia. Can they still make decisions? And so it can get really, really technical and all that. But again, to kind of rewind, Dr. Sheldon, and kind of just put a bullet point on it, I would say, let's get Nancy and the Helping Seniors helpline involved, even if it's somebody in your office and they're because many times it starts that way. It'll be somebody who is interacting with somebody and saying I really want to make sure this person's okay, but I just don't know where to turn next. And that's what we try to do when we do what we do well in the Helping Seniors world.
Very good. Thank you.
Yeah, sure. And so as we're talking along, we really are going to kind of shift around and get into some. I think it's fun because we're at that time of year, and we were just talking about this actually, to be honest, at the Space Coast Florida State Guardianship Association chapter meeting. We're talking about, there's always good and bad in the holidays. It's a great time for many of us. And then for some people, it's a very, very difficult time just because we get lost in a lot of memories and a lot of, a lot of the challenges that come up. So, for example, in the Senior Scene magazine, you get your free copy at 500 locations around Brevard County, or for that matter, you can pick it up online. You just go to Helping Seniors of Brevard. .org, and we always put our newsletter in there, and you can find actually a link to get to the entire Senior Scene magazine if you want to look at it online. But I was going to say, Dr. Sheldon, in there we've put a lot of we called it holiday festivities. It's tips to help you enjoy. But in that, in addition to some fun thoughts, we also talked about, well, what if this is a difficult time of year for you, and that you want to get some, maybe you're concerned and you want to find, see if there's any solutions out there. So we tried to kind of hit both of those. But one of the things that happens as we get towards the end of the year, we're always making New Year's resolutions. It just seems like, it's kind of like somebody hits that big reset button, and we just feel like, okay, this is a good moment for me to tackle all those things that I said I was going to get to, but clearly didn't get finished up this year. And I thought it was so cool, Dr. Sheldon, that that we decided to kind of go after the idea of a dental plan for 2023 and kind of like New Year's dental resolutions, because, as you know, our entire theme ongoing, Joe has talked about it from the day he started helping seniors, has been this let's make an aging plan, which we euphemistically call getting your ducks in a row. And I think it's really cool that you had said, why don't we talk about that, since we're approaching the start of the year. People are going to be making their plans, their resolutions. So we want to remind everybody what a great time to grab a pencil and paper and let's just chat about this. You've been such a great resource all these years of providing not only a lot of insight on specific dental issues, but what's cool about what you do is you really look at the mouth as part of the whole body. I think of all these radio shows and things we've done where you talk about the mouth is kind of like really critical to the rest of your body's health, and you keep being involved in these studies and things which really show that. And that's why this seems to be so important to really say, why are we talking about dental health? Well, it's much more than just dental health, because it's going to impact your whole health in 2023, at least as I follow. Am I saying that right?
It's funny how, dentists, people think of dentists as, okay, between the nose and the chin, that's what we do. And frankly, that's true. In other countries, by the way, dentists train as physicians first, and then they become dentists. And so there's more of an integration. Here, you think about it, well, insurance only pays for this. And medical doctors don't train in dentistry or dental problems at all. So it's like this 4 square inch area has been, maybe it's larger than 4 square inches. Yeah, it is. Has been totally divorced from the rest of the body. Can you imagine that? Your toes aren't divorced from the rest of your body. Your elbow isn't divorced from the rest of your body. Your stomach isn't divorced from the rest of your body. But somehow we have the feeling that the mouth is. And, I work with a great group of doctors who I'll be meeting with right after the show, and we are publishing articles, it's to the profession, on the importance of comprehensive care and the importance of periodontal health. So, there is a tremendous integration. When I got out of school, we were looking at saving teeth. Now we're not just looking at saving teeth or dental implants, but we're looking at the effects of infections in the mouth on other parts of the body, and they're profound. Whether we're talking about heart disease, diabetes, or Alzheimer's disease, whether we're talking about kidney, liver, whatever function we study, there happens to be a dental component to it. I'm not saying if you have Alzheimer's disease, it's all caused from your mouth, but at the same time, there are factors within your mouth that will influence the progression of mental deterioration or mental health. And so, all of a sudden, things that we divorced in our younger years, I'm using the term divorce a lot, that we separated from everything else, at this point in our lives, and I'm a senior too, they're all integrated, and we've got to be able to take care of that. Now, some people might think, I've got to spend a lot of money on dental care. No, actually, you don't. You really don't. What you have to do is to look at the infected areas and take care of the infected areas, and treatment of dental infections is some of the least expensive dentistry that we do. The treatment of replacing teeth and implants and all that kind of stuff, that's the most expensive. But taking care of dental infections is something that can be done very reasonably that most everybody can afford.
Yeah, as you were saying that, I thought one of the opening statements that you were saying in that, it actually made me smile. It's a little bit irreverent, but you were talking about, I guess historically everybody would say, well, a dentist is just concerned with those, whatever you said, the 4 square inches or whatever around your mouth. Yeah. And I was thinking, like, wouldn't that be nice? Fine, I'm just going to drop off my mouth and come by and pick it up later when you fixed it, but it's not that yes. simple because it's like that old kid song, the thigh bone's connected to the knee bone. All this stuff has to work together. And I remember you and I did a whole radio show where you were quoting a really, it sounded like a very wide study where they were overseas, but they were looking at literally that correlation between some oral health, and I think it was heart health. Was that? Am I saying that right?
That was the biggest one when we found the correlation between heart disease and dental disease, particularly periodontal disease. That is what opened the door really to the concern about systemic periodontal disease and systemic health, because more people die of heart disease than anything else in this country.
Yeah. And I mean, it's so interesting that when you think about it, we probably underestimate the importance of dental health in that, because usually, and we've talked about this so many times, oftentimes, and I know I was one of those people, I would just put stuff off until the toothache got too bad, and then finally show up and say, make my mouth stop hurting. And, one of the things that I really think is so important about hearing all your teachings over the course on this is that how much you really have stressed the fact that it's a whole lot more than, let's fix that cavity or whatever, because it's really just a symptom maybe of some other things that are going on.
Yeah, it is. It is symptomatic. It's interesting. I saw 2 patients yesterday that I said, you've got to spend some more time with your physician before you spend time with me. So it does goes in the opposite directions as well. There's only so much I can do. There is a medical problem. I referred to a nutritionist saying, hey, let's get your diet back in order first, and then let's see how capable you are of healing after you get your diet in good shape. So, there is that integration. So it does go from medicine to dentistry, overall health to mouth health, and vice versa. But yeah, I mean, Kerry, maybe I'll put you on the spot again. Maybe you want to talk about what your experiences were and what changes occurred for you, because that may, you can hear it from me all day, but you can, you can say, all right, here's where I was, here's where I am now. Did you have any, when you had dental work done, did you have any profound changes that you noticed?
Oh, absolutely. I was going to tell you, like my story is, we were in Manhattan for many years, and we had a good dentist. We believed him to be a good dentist up there, but then we became full-time Floridians. And so, we just didn't, we had not been able to find a dentist. And particularly my wife, Tammy, was having a lot of mouth pain. And we literally kind of went from dentist to dentist trying to get her some comfort. And, like I said, I was the one that would show up when, like, okay, this is really hurting bad, yank the tooth or whatever you got to do to make it stop hurting. And so I remember meeting you on one of the very first shows, probably the first show we ever did in helping seniors. And I remember how you were, because Joe was hosting the program, and you guys were talking, you'd already started in, you brought in some models, you were showing us actually what was happening. And it made me start to think, it's like, I've been looking at this through like one particular, like solve this problem lens, and not understanding that there was a whole lot more. So I remember going in and you saying, okay, we need to get you started on a deep cleaning and really see what's going on below the gum line. And as I've now been on that regular schedule, I got to tell you, I feel a lot better. And I really think that I feel like there's that connection somehow between, like, if you have a cleaner mouth and you're controlling whatever's going on there, because as you pointed out, it all gets into your bloodstream, right? And so you want to make sure that all that's well. I don't know if I'm saying that medically correctly, but that's just how I feel as a person about it.
It's true. An infection can overwhelm the rest of the body. The body has its defense. It's called the immune system. All right. Well, the immune system can be overwhelmed by bacteria, by viruses, by fungus, by anything, so that you've got your forces there that are there to fight, and then you've got the forces that are there that attack. Well, if the attackers overwhelm the defense, then the defense collapses and you get sick and you have problems. Literally, all you have to do is to reduce the concentration of the bacteria, and then the body's defenses can then recover and then can control things. It's the reason why in our severe periodontal cases where people are about to lose teeth, or at least they think they're going to lose teeth, where we get rid of the infections and the bone comes back around the teeth. It's a very interesting phenomenon. The bone goes away, you control the infection, the bone says, oh, that tooth is no longer dirty, it's no longer offending me. I can put some bone back around that tooth, and we save a lot of teeth that way. So the body is capable of healing. We just have to give it the opportunity to heal, and part of that is just to clean out the wound.
Yeah, and I was thinking even to that. I was thinking about a number of the shows that we've done, and I still think it's a little unusual. And I certainly thought the first time you said, "Here's a topic that I want to cover," and it was literally, "Are too many teeth being extracted?" And I thought,
yeah,
well, that's a funny thing coming from the guy who's like the almost the inventor of implants along the space coast, that you would actually be so concerned about, can we make the mouth healthy, and can we save natural teeth where that makes sense? Let's not just rush to the implant stage as like the next stop on the A train or something.
Yeah, it's true, because whenever anything new comes out, and of course dental implants are now 40 years old, but whenever anything new comes out, you say, oh, that's a simpler solution. That's a better solution. And by the way, implants are great. We do a lot of them here. But
right.
But as soon as we say that's the great solution, then we start to forget all of the other things that we can do to help teeth, whether it's periodontal treatment or root canals or whatever it is. We lose our perspective saying, oh, this is the greatest thing since sliced bread, let's do it. And then we find out a few years later, well, that's a good solution, but it may not have been as good a solution as saving the tooth. We talk about periodontal disease, and periodontal disease does exist in about 42% of the people in the United States. I mean, so it's a big, big, big disease. But what we forget about, particularly if we extract a periodontally diseased tooth, when we could have saved it, is that a person who has periodontal disease is also prone to getting periodontal disease of the dental implant. And that's called periimplantitis. And so we didn't know that when we first started doing dental implants. We thought the same thing as everybody else did. Take out the bad tooth, put in the implant. The implant is nice and it's inert and it's made out of titanium and all this type of stuff. And we'll be able to keep that implant a lifetime. No, we have the same problems with dental implants, particularly in somebody who's had periodontal disease, as we do with teeth themselves. But what's interesting is on a periodontally diseased tooth, we have a much better opportunity of keeping that tooth going. If a dental implant fails, if we start to get periimplantitis, that's a much more difficult disease to control. So as with anything, and of course, we're guilty of it as much as anybody else, the commercials sell the product, but then it's the judgment call of the doctor to determine what's good for you and what may not be.
Now, such good information. We're going to come back on the second half of today's Helping Seniors show, and we are going to have, I guess it's the top 10 points you want to consider in your dental plan for 2023 with our special guest, Dr. Lee Sheldon of Solid Bite Dental and Sheldon Furtado, PLLC. Stick around. More to come.
Great music on this Wednesday afternoon to usher in the second half of our Helping Seniors of Brevard program. Let's get things going. Here's your host, Kerry Fink, and the Executive Director of Helping Seniors of Brevard as well, and Kerry's special guest, Dr. Lee Sheldon. Kerry?
Thanks, John Harper. And, I was going to say, it really is always a pleasure every Wednesday to be here on 90.3 FM WEJF. And hello, also, if you're listening online, there's always folks who find us on the internet at WEJF.net. And also to those who picked this up as a podcast, because we make all this available, on Apple iTunes, Alexa, iHeartRadio, all the places people go to get podcasts. And so we're there, and you can find us there. And thank you if you're listening there as well. And then, of course, we do the old-fashioned thing of putting these out on Facebook and YouTube, if you'd actually call that old-fashioned at this point. But what we're talking about today with our very good friend of the Helping Seniors organization, he's been part of this since literally the day Joe Steckler established this, as Dr. Lee Sheldon. He's a noted area periodontist. He's his organization that he founded and now is in capable hands with his son, Dr. Matt Sheldon, and Dr. Sheldon Furtado, who is another, just like Dr. Sheldon himself, an expert periodontist with Solid Bite Dental right there on Sarno Road. And we've been having this conversation about what a great New Year's resolution would be as it comes to dental. And you might think, well, wow, that's kind of a microscopic discussion. But as we were talking in the first half of the show, Dr. Sheldon, when we get into these 10 points that we're going to cover in this part of the show, really the argument is this is going to help. This could really be a tool in your overall health planning for 2023 also.
It's true. And as we covered in the first half of the program, I'm looking at this, I'm saying the first two items on the list are already covered. So let's talk about item number one. Number one is invest in a comprehensive dental evaluation. And what I mean by that is do an examination with full mouth x-rays and a full periodontal probing to check for periodontal disease as well as to check for tooth decay.
Okay.
If you do that, then you can at least diagnose the most severe areas. Now, particularly people are saying, well, I know it costs a lot of money. The first thing that I'm looking for when I'm looking at my patients are infections first. And we talked about that in the first half of the show. And infections are relatively inexpensive to treat. I mean, if you have an infection that's in your jaw and that has the potential of traveling to another part of the body, extraction is the least expensive way of taking care of that infection. But we would rather extract the tooth before that infection spreads. That infection can spread in two ways. One is that you can get a swelling, and that swelling spreads. But then the other part of it is that the bacteria, once it's below the gum line or is into the bone, it spreads in the bloodstream. And so that's the quiet way that it spreads. So we want to make sure that that infection is taken care of in order to be able to help you with your overall health. That's the first part of treatment after a comprehensive dental evaluation. Doesn't mean you have to do all the dentistry, but it does mean we've got to take care of the most pressing needs. The most pressing needs are always infections.
Yeah, I was going to just add, we're going to reserve a minute at the end of the show to talk about a great program that actually helps us as helping seniors, but it's a great way to help yourself do just what Dr. Sheldon talks about. Just remember the term Solid Bite gives back, and we'll come back to that topic. We'll put a pin in that, as they like to say these days. And let's move on to number two, which is so obvious, but it's so important. It's get your teeth cleaned, right?
Get your teeth cleaned. You're right. And there's the cosmetic cleaning. That's the part that everybody sees. That's not for your health, but below the gum line, it is. And below the gum line, if you have bacteria there, get that stuff out. That's what happens during a dental cleaning.
Yeah. And, I'm looking at number three, and this was a recommendation that came as we started to come to your office. And you said, guys, this is really a good idea because it will really help you fight, I guess it's plaque and things like that you want to see us all do better about. And this is the tool that helps you get it done. And it's not an expensive one.
Nope. The electric toothbrush is fabulous. I've been using an electric toothbrush for almost my entire adult life. There are better electric toothbrushes and cheaper electric toothbrushes. I'd say you've got to spend a minimum of $60 in order to be able to get a decent electric toothbrush. There are some brushes that are cheaper and they tend to spin. Those brushes that tend to spin also tend to damage your gum tissue, particularly if you're not careful with it. At $60, you can get an electric toothbrush that's going to do a good job, and they go up to about $200, $250, and there are better toothbrushes as you go up. But for $60 at one of the discount stores, you can do pretty well.
Yeah, and I like number 4 because this is kind of intuitive, and we probably don't do this well or do this as often as we should. But you're talking about, you take your toothbrush and you work the front and back of your teeth, but are we really working into the sides?
Yeah, it's interesting because if you look at the anatomy of most teeth, there is more surface of the tooth between the teeth than there is on the front and the back of the teeth. In a front tooth, in an upper central incisor, the part that's showing that you can see is only 40% of the entire surface. That's the front and the back. So not just the part you can see, but the part that you can also feel with your tongue. The area between the teeth is 60%. And so that's the area that tends to get periodontal disease or loss of bone support first. So that's why we talk about flossing a lot. But flossing is not necessarily the only way, and it may not even be the best way of taking care of the teeth, the areas in between the teeth. And the reason for that is particularly if you start to have some bone loss, you start to have some periodontal disease, some of the root is now exposed to the outside, and the root itself has depressions within it. And when the root has depressions, the floss will, as you're flossing, it'll go right over those depressions, but the depressions are filled with the bacteria and the floss will never get there. So there is something called an interproximal brush, and you can get that at any pharmacy, get that at any store that sells dental supplies. You're looking for an interproximal brush. Something interproximal means between the teeth. And so it's there in order to be able to get into those nooks and crannies, get into those depressions. And if you can fit an interproximal brush in without jamming it in, it's a better way of cleaning than floss.
I wanted to bring that up is that just again from personal experience. I'd always understood that we're supposed to floss and would try that a little bit, but every time I would go to a dentist, they would still fuss and say, you're still not getting everything in there. And it was when I started going to your office that I got introduced to those little brushes, and they would usually give a sample or two as I would head out the door. And I started to work with those. And first of all, it just experientially, it seemed like it really gets in there and does the job. But then to hear you say that in many cases it's actually more effective, it sort of makes sense now that I've actually used one.
Yeah, and it's faster too.
That's true. And you don't have to keep winding the floss around your fingers, right?
It's true. But I haven't worn floss around my face, except in the dental office. But I buy floss picks anyway. So, and I got floss picks in my car. I got floss picks in my desk, so I can always, I got a story about that, by the way.
Right.
When I was, You ready?
Yeah, no. I was just going to move on to point number 5, unless there was something else we should add into that conversation.
I just want to tell you. I'll tell you the story about a professor of mine at Tufts University. He was a retired colonel, and he would walk around the clinic with a toothbrush in his mouth. His name was Colonel Thompson. He was known as Toothbrush Thompson. So he always had a toothbrush, and he encouraged everybody. In fact, he said you can brush away your decay. I mean, he was really at the top end of toothbrushing. So I went to the Army myself. I was at Fort Sill. We had a professor who was a colonel who was speaking to us and teaching us in my residency program at Fort Sill, Oklahoma. And we started to play Do You Know Geography? And so we talked about, there were 2 of us from Tufts who were at Fort Sill. And we said, do you know Colonel Thompson? And the lecturer said, you mean Toothbrush Thompson? So Toothbrush Thompson was famous even before he got out of the Army as Toothbrush Thompson. Anyway, that's the story. Let's go to number 5. What about a water irrigator? You've got the name, it has something with pick at the end of it. What about that? Water irrigators are used a lot, and there are some good studies on water irrigators. I don't use one myself. I don't necessarily recommend it very often in the office. And the reason I don't is that my feeling is that the brush does a better job. But that doesn't mean that the water irrigation isn't useful. It might be the third adjunct that I would use. It would be first brush, electric brush, second floss or interproximal brush, and third would be the water irrigator, where it just rinses everything out really, really well and makes sure it gets into the sink.
Okay. Well, that makes sense. I had wondered about that. So moving on to point number 6, I thought this was interesting, and I actually have a question, although you may explain it as you explain this point farther. You say buy a chlorine dioxide toothpaste, which I have I know certain of the brand names we all see the commercials for, but I don't know exactly what chlorine dioxide toothpaste is.
Do you know what chlorine dioxide is used for? It's used in airplanes. They clean out airplanes between passengers with chlorine dioxide. They use chlorine dioxide. It doesn't smell. It places on the seat and on the, in the surrounding area, the plastic and everything else, places a chemical that doesn't smell and releases oxygen, and it kills bacteria. So, wow. And it's totally non-toxic. And so they started making chlorine dioxide toothpaste. So not only are you brushing your teeth with something which has a little bit of a detergent in it, but also you're applying a chemical that's totally non-toxic that may very well help you heal and reduce the accumulation of plaque or bacteria and reduce the tendency to get sulfur compounds in your mouth. And of course, sulfur compounds is what causes bad breath. So we've been using a chlorine dioxide toothpaste. There are 2 of them that I know about. You can pick them up at any pharmacy. I won't mention brand name, but if you're very close with somebody and you have a sister and you combine those 2 names, you may be able to find that toothpaste at a pharmacy.
So is this something that we look for on the ingredient label?
You would look at it on the ingredient label, correct? It would say that, and you can buy that in most pharmacies. I can tell you I've seen it at Walgreens. I'm not sure that it's the CVS, but my guess is that it is there too.
Probably so. So that's the point. Get
chlorine dioxide, or if you went on Amazon and put in chlorine dioxide, you'll find it. It'll.
Oh, okay. Well, the internet.
I'm sure it'll show up
on the search then.
All right, and then Amazon search while we're talking, but let's talk instead.
All right. So moving on to point number 7, which is, I guess, closely related to toothpaste because a lot of us use it, is mouthwash.
Yes, and they do make that. They do make a chlorine dioxide mouthwash as well. Same brand. Close sister actually makes a chlorine dioxide mouthwash. Now, I'm already using chlorine dioxide toothpaste, so now I'm going to use zinc chloride mouthwash. And I like the one that comes in two containers that are fused together. So it looks like one container, but it actually has 2 containers within it. And the reason for that is that the 2 liquids mix together and they activate at the time that you're actually rinsing out, and is and just works very, very well. Now, if you're very smart and you happen to have a mouth, then you'll be able to figure out the name of the rinse that I recommend.
I love it. Or you could just Google it on Amazon.
Yes.
Right?
Yeah. Put in something like, I'm really smart and I have a mouth, and just take the operative terms. You'll find it there.
That's good. I love it. Folks, this is non-commercial, right? We're a nonprofit. We're trying to just give you good information. So we're talking with Dr. Lee Sheldon.
And by the way, if you're not sure of what I just said, just write to me, Dr. Lee, DRLEE, at solidbite.com, and I'll tell you what it really is.
There you go. I like that. That's even better. And we're, like I said, we're going to reserve a minute at the back of the show to talk a little bit about point number 1, and a great way to take care of point number 1. Invest in a comprehensive dental evaluation, which really is not even an investment the way it comes out. So we'll come back to that. But number 8, you say you got to thoroughly remove plaque from your teeth once every 24 hours. What is that? Well, I mean, I think I know what we're after, but the question is, how would we do that, or how do we make sure we're doing that?
Okay, so you use the item number 1, number 2. So you're going to use the electric toothbrush, and you're going to make sure that you use that electric toothbrush for a full 2 minutes. Many of the electric toothbrushes, they have timers on them now, and so they will tell you when your 2 minutes is up. And the one that I have gives you a big frown on the face of the toothbrush. There's a little digital display. It gives you a big frown if you haven't gone to 2 minutes. It'll give you a smile when you get to 2 minutes. So it will give you positive reinforcement to go to the 2 minutes. But you also want to use something between the teeth. And we talked about the interproximal brush or the floss. If you don't have any bone loss, floss is fine. And use that between the teeth. Now, the understanding is that you're doing this to remove plaque. And plaque is a bacteria that will accumulate on the teeth whether you eat or not. Why am I saying this? Because you've always heard, brush your teeth after every meal. Well, a meal doesn't have plaque. Your mouth has plaque. Food doesn't have plaque. Plaque is a bacteria that naturally grows, and it'll feed on the food that you eat. So therefore, if you remove the plaque once a day, fully remove it, so spend a good 5 minutes on your teeth once a day, that will be sufficient to remove the plaque, reduce your chance of periodontal disease as well as tooth decay.
That's important. That sounds really, really like an important piece of advice. Just to remember, you could get this done 5 minutes a day and keep the plaque away or something like that.
That's good.
Point number 9. This one is I've heard you talk about this before, but I'd forgotten about this. You say buy some pH test strips. Talk about that.
pH is a measure of acid level. And as we get older, we have reduced saliva, and when we have a dry mouth, your mouth becomes full of acid. The other thing is many medications cause the mouth to become acid as well. And of course, when the mouth is acid, that means you've got acid bathing the teeth, and the teeth will start to decay. It's the age-old question is, I never had a cavity my entire life. How come now at the age of 70, I'm starting to get decay? And it's this reason. That's the reason for it. So you want to reduce the plaque. You want to remove the plaque once every 24 hours, but also you want to take care of this acid that's in the mouth. Best way of taking care of the acid, by the way, is to rinse out with a baking soda rinse. And if you use baking soda rinse, 2 teaspoons of baking soda and 8 ounces of water, and just keep it as a flask and rinse out every 3 hours, and that will, for most people, reduce the acid sufficiently in order to be able to help them help reduce their chances for tooth decay.
Oh, sounds important. And number 10 is obvious, although probably you have to remind us every time we visit. And I remember even this as being a kid, growing up, you go to the dentist and they're always telling you, let's stay away from the sugar pop kind of things and things like that. But, you really make a big point about this overall is why it's so important.
Oh, it's such a big deal. It's such a big deal, Kerry. I mean, the number of people who see us for treatment would not nearly have to have as much treatment done if they did not eat sugar. Sugar is devastating. So imagine you mix sugar with acid, and essentially you've got the bacteria feeding on this and just going wild. The plaque excretes the sugar. When it excretes the sugar, that produces more acid, and the teeth just dissolve. We get the idea that sugar is okay. Yeah, sugar is okay in moderation. We talked about this last month. What's the definition of moderation? 3 exposures to sugar a day is about all most people can really take. And that means 3 exposures. That doesn't mean you're sipping a Coke from noon to 5 and sipping a little bit every few minutes. Each time you sip it, that's a new exposure. Each time you get a new exposure, that's 20 minutes of acid working on the teeth. So if you're going to eat your sugar, eat it fast and don't eat very much of it. And 3 exposures a day is about all you can take. Many people can't take any exposures at all.
Wow. And I'm thinking, what an interesting week to be talking about this with one holiday party after another.
Yeah, no kidding.
all these great, dessert treats, Christmas cookies, and all these different things are out there. But your point is well taken. Well, we've got a couple minutes left. We've run through the top 10, but I do want to come back to point number 1 about investing in a comprehensive dental evaluation. And this is really helpful because it helps us as a nonprofit organization because this really helps us. But at the same time, you really are helping yourself. Talk about the Solid Bite Gives Back and how somebody gets into that.
This is something we put in many years ago now, and it's worked out so well. People are so appreciative. The charities are so appreciative, and Helping Seniors of Brevard is one of the charities in our charitable giving campaign called Solid Bite Gives Back. Essentially, what you do is say, I was referred by Helping Seniors of Brevard, or I was referred by this radio program. You call the office, you say that, and what you will receive as a result will be the full dental examination, including all x-rays, including a dental CT scan, all for a donation of $50 or more to Helping Seniors of Brevard. You'll be here for a full 2-hour visit. We'll give you a full assessment as to what's going on. You can decide what you want to do or what you don't want to do. We'll give you priorities. We'll give all of those things because that's what we do for everyone. And you'll be helping a charity at the same time.
And what I love about this solves so many things because you and I have actually done radio programs and TV programs where we've talked about this. So number one, you as the professional trying to figure out what's in our best interest as the patient, you really need all that information to help you guide us correctly. And so this is giving you the tools you need. And normally that would cost us a tremendous amount out of pocket just because of the professional time and all the equipment and things that you bring into play for that. But it becomes a really great deal because it's very cost effective for us as a consumer to learn where we really stand. But then it's also benefiting and helping little nonprofits like Helping Seniors of Brevard keep doing service in the community. So it's really like a win-win-win. Everybody comes out better when somebody chooses the Solid Bite Gives Back program, I think.
Yeah, it's true because this exam is worth well over $400, but that is the point. The point is what you said initially, Kerry. I can't tell what you need unless I have all these tools. And the last thing I can do is say, well, I want to charge you for this, and I want to charge you for this for the diagnosis. So instead, give a donation to Helping Seniors. I get all the tools that I want to use, and and I can give you some options at different price points, if you will, that will work for you.
Yeah, and so if somebody wants to take advantage of it, or just have a question, or maybe they wanted to find out the name of that toothpaste or whatever, how do they get in touch with your office? What's the best way to do that?
Just call us at 321-259-8000, and anybody here will be able to help you.
Yeah, and I think what a great New Year's resolution would be to go ahead and call in and maybe see about look, I really want to know where I'm at on this continuum. So one more time, if somebody wants to get that information or understand a little bit about how all that program works, the Solid Bite Gives Back, the number again? Yeah,
the phone number is 321-259-8000, 321-259-8000.
And I want to remind you, especially if you're new to Helping Seniors or you just run into this, because so many people are moving into Florida every single day. We were talking about that at one of the holiday parties this week, just how the population is exploding. So all these people come in, they don't really know where good resources are locally. It's one of the reasons we exist is Helping Seniors Brevard. And maybe one of the most valuable functions that I hope we're able to accomplish as Helping Seniors Brevard is get that kind of information that helps you improve the quality of your life as a senior by knowing the right, first of all, maybe learning the right questions to ask, but then certainly learning the right places to find some answers and to do that effectively. And I think one of the things Joe Steckler, our president and founder, has really been able to do over the years, he's pulled together a collection of people who really care about the folks that they're dealing with, in particular the seniors, and have that commitment to excellence for that. And so it's one of the reasons I'm really grateful for the work of Helping Seniors of Brevard, and now going into 12th year of service in the community. And so I want to thank you, Dr. Sheldon, for just having really stood by the organization all these years. But I also think it's been a real blessing to the families and the seniors that have come in connection with this information. And there's so much, you've done so many, like we were joking, you actually, I think, were the first TV show that Joe did when he was first getting the organization started. All that's still available to you on our Helping Seniors of Brevard YouTube channel. You can find these on our Facebook page. You can actually go directly to our website, Helping Seniors of Brevard. and take advantage of all that information there. And so all these programs are always made available because we find people will run into something at a certain point in time. They'll say, "Oh yeah, I want to, search, do an online search and find out the answer to that question," and then these shows will pop up. So thank you, Dr. Sheldon, for sharing your wisdom and your good ideas about New Year's dental resolutions as we head into 2023. I think it's going to be a fun and exciting year, and we're really excited about the road ahead. With helping seniors as we continue to try to do our best to expand service to really reach the growing number of seniors in our community, Dr. Sheldon.
Yeah, it is. And it's exciting. Look at all the people who are moving in here. They've figured out what we figured out for years, which is great. Want to wish you a Merry Christmas, Kerry. Jim Buttrow, who's producing this, John Harper, and everybody helping seniors, as well as all of you listeners. Merry Christmas.
Terrific.
Happy New Year.
Well, terrific. Thank you, Dr. Sheldon. We'll see you next week on Helping Seniors Radio.